Hello, the topic of the day is what are the various home remedies that can be tried to decrease the risk of repeated urine infections. Urine infections is a very common clinical problem which is seen especially in females. So let's get started. The first measure that you can try is to optimize your fluid intake. Now the recommended fluid intake is around 2 to 3 liters per day. However, it's very important to remember that when we are talking about fluids, it's like not one size fits all. So the requirement of fluids will be much higher on a hot sunny day. If you're sweating a lot, the target should be that the urine is pale yellow in color. It should not be high in color. It should not be dark yellow in color. Some people think that drinking lots of water will solve all their medical problems. Unfortunately, that's not how it works. Drinking 5, 6, 7 liters of water per day might even do more harm to you than good. Second important point to remember is that both constipation and diarrhea, both these conditions will increase the load of the pathogenic bacteria around the opening of the bladder and will predispose you to develop repeated urine infections. So try to have a regular bowel movement, avoid outside food, eat healthy. Thirdly, some females feel that it's normal to void 2 times in a day. Remember that whenever you're holding urine is stagnant, it is warm, and bacteria will get more time to multiply. So the recommended frequency of emptying the bladder is around 6 to 10 times a day. Fourthly, there are a few supplements that have an antibiotic sparing effect, like cranberry extracts. You can take cranberry juices. You can take 1 cup or 250 ml once or twice a day. It is advisable not to go ahead with the packaged cranberry juices. Why? Because they contain a lot of sugar. So anything that has sugar, it will negate the beneficial effects of the extract per se. Try to maintain a good perineal hygiene, right? So whenever the area around the opening is dirty, definitely and obviously you will have a higher risk of developing infections. If you are a habitual user of toilet paper, try to develop a habit of cleaning from front to back and not the other way around. Finally, few patients are on certain medications that can predispose you to urine infections. So if you're already on certain medications, then it would be a good idea to talk to your physician whether there are certain medications that is predisposing you to develop these symptoms, right? For example, there are a few anti-diabetic medications like dapagliflozin, canagliflozin. They are increasingly being prescribed, even though they are very beneficial, but some people might experience a flare of their symptoms of urine infections. Now, even after all these measures, if your symptoms are not getting relieved, then definitely it's a very good idea to talk to your physician about it. You might require antibiotics, right? So please don't self-medicate yourself. It will do more harm than good, right? And most importantly, the physician might need to confirm your diagnosis. Why? Because there are a number of conditions that can mimic the symptoms of urine infections. You might have a stone. There might be something even more deleterious that is going on. So please get yourself checked out. You might need certain tests. You might need ultrasounds or other imaging modalities. So if I were to summarize, have an adequate fluid intake, have a good intake of the fibers so that you have a good bowel movement. Then you can take cranberry extracts that can decrease the risk of repeated urine infections. don't have a habit of holding your urine, and keep in touch with your family physician. Get yourself checked up. You don't need to suffer. Thank you.